Hello, I'm Dr. Suhel Hasan. I'm a senior ENT consultant at Narayana Health. And with me is Esther. This young lady is from Nigeria and came to us a few months ago with breathing problems, speech problems with a tracheostomy due to tracheal stenosis, which was managed in Nigeria, but she did benefit from the treatment and came to us for help and treatment. Also had multiple fractures on her legs, and since then we have been seeing Esther, and she was admitted in our wards, and we did a surgical procedure, and I'm happy to say she's fine as far as the neck and breathing and voice is. And I gather you had an accident.
Yes.
So that was in when?
2021.
2021.
November 2nd.
November 2nd, 2021. So you could tell us briefly what happened after the accident and how you had problems with, breathing and voice, and then, of course, injuries to your leg, and how you came to us for treatment.
Yeah, so after the accident, I was unconscious. And when I woke up, I was having difficulty breathing. So they took me to ICU, intubated. And after the intubation, they had issues.
So you were intubated for, say, a week, 10 days, and then you were sent back to the ward, and then they realized you had some breathing issues.
Yes. I was in the ICU for 9 days.
Okay.
And after I got discharged, I was having difficulty breathing. I was coughing, sometimes blood.
Okay.
And then after a month, my trachea started to close.
Okay. So, but when you were having breathing problems, they did a tracheostomy for you. When did they do the tracheostomy? Quite soon?
After a month.
After a month?
They didn't notice anything was wrong before then. So when I finally complained, we did a CT scan, we did soft tissue x-ray, and then they did the tracheostomy.
Okay, then they did the tracheostomy. So how long were you with the tracheostomy?
For 2 years.
For 2 years. So breathing through the track, but how was your voice?
I was not talking.
You were not talking.
No.
So in between, you said you had some procedures done while you had the tracheostomy?
Some serial dilatation, yes.
Serial dilatation. So they dilated your trachea. How many sittings?
6 times.
6 sittings. It used to improve a bit, but then again it used to go back. So it used to affect your voice. But of course, you were breathing through your tracheostomy tube.
I was.
All
but
right.
Sometimes the tracheostomy tube would get blocked by granulation tissue.
Okay.
One time it got blocked and...
They had to remove the whole tube and put in a new tube?
Yes, but after it took a while. I was choking, and the nurses and some of the doctors that were on duty did not know what to do because they were inexperienced with people living with trachea and people with tracheostomy stenosis. So
okay, so then I think after serial dilatations, it didn't help you. So then I think somebody suggested that you need an open neck surgery.
Yes.
So then you decided to come over to India from Nigeria.
Yes, I did.
That's good. And you of course, with your accident, you had fractures of your femur, thigh bone,
lower leg.
And the lower limb. So I think you're still undergoing treatment here at Narayana Health for that, while we've done some surgery and helped you now with your voice, and you're able to remove the tracheostomy tube. Well, I'll quickly say that Esther had quite a severe tracheal stenosis above the tracheostomy tube, and that was causing her, complete obstruction. Actually, when we did remove that part of the trachea, it was completely stenosed or obstructed. So we resected that bit of the trachea and anastomosed and removed your tracheostomy tube at that sitting. So we are able to hear her lovely voice now, and she's breathing well, and still staying in Bangalore in NH to get treatment for her leg, and she's had a couple of procedures on your leg, and we hope that you were able to start walking, so you're able to bear weight now. Yes. On your leg.
It's much better. Since the surgeries, I've noticed a lot of improvement.
Okay. Anyway, it's this little story. I know that you had a long period for over 2 years or more, I think, without your voice and a tube in your neck, and we are glad we are able to help you with that and get you speaking. And she also is keen to become a nurse, and if possible, come and do your nursing here in this hospital. Anyway, that would be wonderful if you can do that. And hope to see you walk out of Narayana soon.
Thank you.
All right. All the best.
Thank you.